The possibility of a new state mental hospital built in Yellowstone County has a lot of people talking.
That includes local mental health providers as the state continues to keep Billings or Yellowstone County at the very top of the list as the new place to build that new forensic mental health facility. A coalition of Yellowstone County mental health providers put together this gap analysis document trying to get in front of what could be coming, laying out clear concerns that must be addressed.
Health officials say Yellowstone County is fortunate to have these many organizations open and able to meet the growing mental health needs. But if a new state mental health facility like this one in Warm Springs were to be built in Billings or Yellowstone County, it could tip a delicate balance over the edge.
But currently we are at that precipice of being able to keep the lights on at our own facilities and staff our own programs.
So a coalition of mental health providers produced this gap assessment outlining what it would take for Billings to be ready.
We have several gaps that are going to keep this facility from being successful and sustainable.
Some of those gaps identified include not enough doctors, nurses, and staff, lack of step-down support transitioning out of prison, and continuity of care for medical needs, among others.
And that was the point of the analysis, to come together with a unified voice.
Why do I want it here? I have the women's prison. I have 90% of the sober living homes. I have all the probation and parole programs here. I mean, what am I, the dumping ground for the state?
But the state is doing its homework. A new recruiting campaign is already bringing in nurses, and after some early fallout, they're making it a priority to meet with stakeholders before a new facility is decided on, according to DPHHS Director Charlie Brereton.
We understand, right, the interest, especially in Billings and Laurel and Yellowstone County at large. We will be there if that is ultimately the preferred location for the facility, to meet with local officials, city council members, county commissioners, mayors.
To create a two-way conversation, to change the public narrative around this, to reframe the conversation into saying, this is a need. We understand the need exists. How can we address it in the best way possible?
An address that county officials are still waiting to hear.
There still has been no discussion between ourselves and state DPHHS.
DPHHS says it has drafted a letter to be released to the public that addresses the projected statewide system impact that a forensic mental health facility would bring. We have made a request for that document and will continue to follow this story.